Good morning. Welcome back. Welcome to Expat Insights. I'm your host, Raju Mandian. Here at Expat Insights, we take external views of internal successes by foreigners, expats, and immigrants who have made Philippines their home and are doing good in the Philippines, either in business or society. This Friday morning on Expat Insights, we have two guests. Both of them are chiropractors, board-certified chiropractors from California. Dr. Malcolm Warren from Life Chiropractor College West.
You got it.
I got it. LCCW. And Mia Balbas, also a doctor. And they are here to discuss with us bone health and bone wellness, which is very important in today's times. And so let's take it up with Dr. Malcolm Warren and Mia Balbas. Balbas is right?
Yes, that's
Balbas?
right.
Balbas.
Balbas.
Balbas. So welcome to Expat Insights, Dr. Malcolm Warren.
Thank you.
And Mia.
Thank you.
So maybe give us a little background on about what it is to be a certified chiropractor from California.
Well, we're a board-certified chiropractic physician from California. Means that we did our boards in California. There's four different boards that are required to get your licensure to be certified to practice in the state of California. Each state in the United States has various boards that you have to take. We just did the California ones because that is where we attended school. California happens to also be the most rigorous in their board exams.
In comparison to what other states? Other three states? You said four.
Oh, no, there's 4 parts to getting your licensure. I think that
There are 4 stages.
Every state has different requirements for board exams
horrible
and getting
tests.
licensures.
So how long does it take for one to become a chiropractor? Because I know to become a doctor, it takes about 6 or 7 years after school. Maybe more, no? 8, 9 years. How long does it take for you to become a chiropractor?
Go ahead.
Oh, well, it's the same as dentistry. You can do, 3 years. Actually, if you're really hardcore like her, you would do it 3 years.
In 3 years.
Which is hardcore?
Yes, there's no summer vacations, nothing like that. The regular track is about 4 years.
Right.
And then if you choose to expand your knowledge base, then you can always study more.
Get more
programs after that.
certifications.
Yeah.
Wow.
And then that's what took us to where we're at now, because we're actually specialists within chiropractic.
Tell me about your specialty. Yeah, great.
Well, that's called upper cervical. We're upper cervical doctors. Now, what is that? That is a practice within chiropractic, a specialty in which we concentrate just on the upper cervical complex.
Yeah.
That is the area called C1 and C2, right?
Yeah.
At the base of the skull.
Yeah, Doc, you can pick up that thing if the things you already brought, no?
Sure thing.
Yeah, there we go.
Actually, why don't we do this? I will show you. Let's start out in full spine.
Folks, Dr. Malcolm Warren has brought, you call them models or aids? You call them models, right?
Spine.
So he's brought a spine and he's brought the upper cervical complex.
I did.
Which is right here. And he's going to not just teach us, he's going to show us. Okay, there you go.
Okay, so what we have here is just a regular spine. Actually, I think this is one of my old patients.
A bad patient.
Isn't that right, George?
That's what is left of him.
So this is just a regular full spine model.
Yeah.
And in chiropractic, full spine chiropractic, what we seek to do is resolve the cause of disease, which is called the subluxation. The vertebral subluxation complex. Now, what is that? Mouthful, right? Okay.
Wait, go. Let me hold this. Yeah, let me hold it. Go ahead. Take it from the top again. In regular, you said yes. Start from there.
So the thing that we are seeking to resolve is the cause of all disease.
Yeah.
In chiropractic.
Yeah.
Okay. Versus just looking at symptoms. So what do I mean by that?
Yeah.
I mean removing what is the subluxation. The subluxation.
Subluxation?
Subluxation.
Yeah.
Is that English?
It is English.
Actually, yes.
Subluxation, all right.
And actually, let's take an aside on this, because they're actually used in both disciplines. In chiropractic, we use it more of in a neurological sense. Surgeons look at it as a luxation of bone out of place. Now, the medical world has a very similar term that we do for subluxation, but it's even worse. It's called the loss of instantaneous axis of rotation.
I'm lost already. I'm lost. I mean, it's just a spine, and I'm
lost.
lost. Yeah. So,
all right. So I'm sure you probably read
so
it.
you don't cut this up. As a chiropractor, you don't cut it up.
No, there are no drugs, no surgery.
You move this around to take care of other illnesses.
Exactly.
That's what you do.
To remove that loss of instantaneous axis rotation, or let's call it subluxation.
That's subluxation.
Yes, which is a foot on the water hose. That's all it is. It's a lot of complex terminology to simply state that the information is not flowing at 100% from the brain to the rest of the body. Foot on the water hose. That's it.
Ah, okay.
We remove
so that's the
foot.
metaphor. So it's squeezed, and you unsqueeze it.
Exactly.
So you squeezed nerves,
You could say
not
that.
the bones,
Exactly.
because the bones, the nerves run through the bones. Okay, fine.
Exactly.
So I get it. So that's what your job is, and both of you do this, and you've been doing this for 10 years?
No, not that long.
Since,
Not that
Say
long.
about 3-4 years.
In the Philippines. All right. So let's hold this. We need to take a break. We used up 10 minutes. Would you realize this?
Wow.
that fast.
10 minutes. So we used up 10 minutes. We'll come back, and now Dr. Malcolm Warren and Mia will tell us the insides of this and how to keep this healthy and well after the break. So stay watching. This is Expert Insights, and I'm holding somebody else's private parts. Stay watching. Come back to you. Good morning. Welcome back to Expert in Science, and we are talking about bone health and wellness with Dr. Malcolm Warren and Dr. Amia Balbas. I got that right this time. And he was using a phrase called a foot on the hose. So Dr. Malcolm Warren, take it from there. So that's what you do, remove the foot from the hose.
Exactly.
And how do you do it?
Okay, so to remove the foot from the hose, what we do in full spine chiropractic, may I borrow our friend here? Oh,
Yeah, go ahead. Jones.
Yeah, Jones.
Yeah.
All right. So we have our patient here, and
Yeah.
let's say that there's a problem in the low back. That would basically, I don't know if the camera could really get in on
Yeah,
that.
that's enough.
Okay.
Yeah.
So we would basically say that this bone is being impinged by a bone out of place.
Okay.
That's making it really simple. These bones really never get out of place.
Yeah.
But it's enough to cause a neural distortion.
Oh, so
They're-
they don't really get totally distorted.
No.
So
No,
when
not
somebody
at all.
says, "Hey, I got I twisted my bone," it's nothing
No.
like that.
No, they barely.
Because you'll die right away if that happens. Huh? I would
Pretty
assume,
painful.
no?
It'd be pretty bad.
So it's just a little bit of a stress on it. Okay.
Which will then distort the function of the neurology. It'll change very slightly the flow of neural information. That is what causes the problems at the end organ. So in full spine chiropractic, they find these areas and they adjust them. Now, what is the adjustment? That's taking that slight stuck bone and unsticking it, putting it back in place, then allowing it to move, and then allows the information to start flowing again properly. Now, to take it to the next level, what we do in upper cervical is we deal exclusively
This is upper cervical.
with this area.
This is the
Exactly.
Top three bones of
top three bones of
the
your
neck.
spine, yeah?
Let me explain that. She can
Okay.
explain it far better.
Okay.
Yeah.
Well, again, if we were to zoom in just the top part of Jones over here, we'd
Yeah.
end up with something like this.
Yeah?
So this is the bottom of the skull,
Mm-hmm.
and if I flip it down,
Yeah.
I'll expose the top bone.
Known as the
It's
atlas.
called the atlas.
The
And
guy
if
who
you're
picks
familiar
up
with
the-
Atlas Shrugged, right?
Yeah.
There's a person holding up the world.
Yeah.
So similarly, there are these spots on the bone called condyles, and they
Yeah.
hold up your skull.
Right.
So essentially, what we're looking at is probably the most important bone in your spine, and some would argue probably the rest of your body.
Yeah.
And we seek to correct whatever complaint you may have. We always look at this bone in your body.
So if I have a lower backache, you would still go up and look at the upper cervical complex?
Absolutely. Because in order for the information
To me, I mean, from a layman's point of view, and of course I've suffered backache a couple of
feels
times. I've had
counterintuitive.
my back x-rayed several times because of an accident. But so that means when I have a stiff lower back, yeah, I find it hard to walk, or hard to bend down. You will focus on my top three?
Yeah.
Is it right, doctor?
That is right.
Okay, whoa.
Yeah.
I've never heard of that before.
It's sort of a new, it almost seems counterintuitive.
Yeah.
But essentially, no information passes through any part of your spine. So let's say you did have a lower
All right,
back
so
issue
that's the gateway
without
to the
passing
rest
through-
of the body.
Exactly. So you said it yourself.
Oh.
It's really the gateway through which a lot of really important information passes. So no matter what we do to your lower back, if you have some nerve interference in that spot, which is where your brainstem really lies,
Yeah.
then really you can't guarantee that the brain is going to see that we're trying to do something in the lower spine, if that makes any sense.
No, tell me that one more time.
Maybe you can clarify.
Malcolm, yeah. I mean,
one of my
it was
favorite
making
things.
sense, but I need a
Yeah,
little more
yeah.
clarity. Yeah.
This is one of my favorite things to do at lectures. Let's see if we can use this camera here.
Yeah, okay.
Okay, we're going to play with this. So, can you zoom in on me? I wonder if we could do this. All right. So, for my viewers at home, we get my eye with yours. Okay, so, I'm almost there. But you guys can basically see me, right?
Okay,
You
yeah.
are the brain at home. Now,
Oh.
that's the view that the brain has of the rest of the body. Now, in the situation where there is trouble or you're sick, a subluxation, now this space is now occluded. You see how difficult that is to see. So that's the situation that the brain is looking at. So
Okay.
what we do, we remove this obfuscation, and now we've removed the subluxation. It's now clear. So
Yeah.
that's what it is for the brain. You just clean the window up.
Well, when you say see, you're using that as a metaphor.
As
What
a
you mean
metaphor.
is sense.
It's sense.
The
as
brain senses the rest of the
neural
body.
flow. Exactly,
Okay.
because the brain is constantly watching everything that's happening throughout the
Right.
entire body. And
So-
it runs a systems check all the time.
So
to make sure
this
things are
this
functioning.
also means internal organs, digestive organs,
Yes.
respiratory organs, and even the heart is watched through that little window that you just showed me.
Yes. Actually, we could
Yeah.
use this example here.
Yeah.
This is great for any of
Can
your
you
physicians
zoom in on
at
this?
home.
Yeah.
So you may, I'm sure you have a lot of physicians watching this. This
Yeah.
was put together by actually one of my teachers and also hers, Dr. Dan Murphy. He's a chiropractic neurologist, and he developed this.
Okay.
Now, bunch of really fancy, crazy things going on here, but just the basics. We have upper cervical mechanoreceptors from
Which
chiropractic.
is
upper cervical
what you
adjustment.
specialize in. Yeah.
Exactly. So what does that mean? Upper cervical, that's the upper neck. Motion detectors. That's all the mechanoreceptor is. Because this area is one of the most rich in the body in motion detectors. Those motion detectors make sure that everything is functioning properly. As we say, movement is life. So that kind of simplifies things. Let's spill down and make that make more sense.
Yeah.
So let's
well,
say
this
you're
is what the
stuck.
brain is looking down at. That's the
Exactly.
view from
That
the top.
is it.
Okay.
That is it. So let's say that you now have a subluxation. So what does that mean? The brain cannot see the rest of the body.
Yeah.
There's a foot on the water hose.
Yeah.
Okay, let's remove that foot on the water hose. So we go here, we make our adjustment. Now, that will spill down, forget these guys here, but it will do a systems check
Yeah.
and go to the tonic postural reflexes. What does that mean? All that stuff that holds you up and gives you a really good posture.
Yeah.
Some people have difficulty in that area, soreness, asthma, whatever. That will go and look at those muscles.
Yeah.
Okay? Then we have another part that will spill down and go to the cerebellum. What is that?
Up
That's-
here.
Yeah, exactly.
Yeah.
Actually, right in here. Since I'm bald, I make a good model, anatomy model. That's the motion detector center
Yeah.
of the brain.
Yeah.
So it goes in there. Hey, everybody okay? Everybody okay? Can I get you some water, food, guys?
Yeah.
Good? Okay. So we check there. It comes back out. Yeah, we're okay. So it spills down. It goes to cardiorespiratory circuits. Those are really going into the deep stuff in the lungs and whatnot. Heart.
Yeah. So converting oxygen to blood. That's what the main job of that group
All
is.
that
Yeah.
stuff.
Okay.
Then we go back over here and we get more stuff going on in the chest cavity. More really big stuff. Parasympathetic. Before we go into that, the parasympathetic simply means the rest and digest system. And for all of us here in the Philippines, we're familiar with San Miguel. We're familiar with sisig. Two great things to have a party with. So I always say, this is the rest and digest, the
Yeah.
San Mig and sisig system. So
Yeah.
you always relax using parasympathetics. If you use your sympathetics, you're using the fight or flight system. Something's going to eat me. Lions and tigers and bears.
Explain
oh
that
my.
again. One more time.
Okay, so
yeah.
Parasympathetic means rest and digest. You're relaxed.
Yeah.
Okay. Now, your sympathetic is the fight or flight system. Lions and tigers and bears, oh my. So that's the system of the body that protects you when you believe you're going to be eaten alive by a tiger or a bear or somebody's going to rob you. So that's a very stressful state that most of us live in. This is what's so important for everybody, to make sure that they are checked. They get that scan done that we'll go into.
Yeah.
So we check this. Hey, now that we know what this word is, parasympathetic, basically it goes in, hey, is everybody relaxed? Everything doing good? Yeah, we're okay. We're
Is
relaxing.
the production working well? Yeah?
That's it.
Are the goods coming in and going out at the right time?
Right. It's
That's
just
it.
like
Okay,
a
okay, that
systems
makes sense.
check.
There you go.
Yeah, okay.
And then finally you spill down. Once all that's okay, it'll spill down and say, okay, everyone relax and be happy.
Yeah.
Again, parasympathetic, rest and digest. That is the optimal place.
The
to
board
be.
of directors are at peace over here.
That is exactly it.
Okay, now I get it. All right, so many metaphors in there, I get lost in there. So basically, one more time, without the metaphors, is that you're watching all this is what is happening at the brain level, this is what is happening at the body level, and there's a conversation happening until everything functions well.
Exactly.
Did I get that right?
And
Yeah, okay.
that is what happens with the adjustment. So
Okay.
you come in and you say, I have this going on. The typical procedure would be that we would find out if you're a candidate for this care. Not everyone is a candidate for this type of chiropractic
For
care.
ACC, the one that
The
you do.
Upper cervical, yes.
Not everyone is.
Not everyone, no.
Oh, what? You just mentioned that everything passes through here. That's a gateway to the rest of the world.
That's true.
And yet you're saying that how do you explain that?
Well, we'd have to find out if you're a candidate. How do we do that? We use, we can actually, I can
this
take
down?
that
Use
away.
a what?
Sure.
Yeah, you're done
We
with
can
it?
use what's called infrared thermography or
Yeah.
computed digital infrared thermography. Now, what is that? That is a means of seeing what the nervous system is doing. We can find out if you're in a state of what's called pattern, meaning you're repeating the same shape all the time. Why?
Same shape?
Same shape, because it prints out squiggles. I call them squiggles on the screen. What this is a mapping of heat on both sides of the spine, because both sides are equal, are they not? They should have equal heat signatures in health, in a state of homeostasis, because homeostasis is what? Balance, right? So when you have a subluxation, you're no longer in a state of balance. We can then detect that within the nerve system by using this technology. It is also used at many universities around the world for research.
What's it called again one more time? Red?
Infrared thermography.
And it's like an X-ray? It's like a...
No, this is the beautiful part about it.
Yeah.
It is non-invasive, and it takes 7 seconds to scan you. We just do a little scan of your neck. We can do the whole spine if we so need.
The whole spine.
We can. We
Yeah.
can. But we will map you over time. So from week 1, I'll scan you. Okay, I have this problem. We'll do our consultation. I have this problem. Okay. Let's find out if you're a candidate. We will first start by making these scans. We will allow you to rest for 15 minutes. Make sure that you have not had caffeine, alcohol, or other things that will stimulate the neurology. If that is okay,
That'll heat up the neurology.
that will
because
stimulate it in any way, either up or down.
Okay.
So we want to get a pure view of the neurology. We'll have you rest 15 minutes. That allows everything to rest because it's very active, remember? The
Just
upper
like blood pressure, if you work out, then it goes up. So
you go.
like that, okay.
That's true. To a point. Now we're getting into the catch. We'll scan you after 15. Really doesn't mean anything. We just have a scan. I have 7 seconds into, I'd say you're 48, 46.
Me?
Yeah.
35.
There we go. 35 years. So we take a 7-second view of that. And then we bring you back again next week, maybe even next month or another month. So we have separate instances to look at your neurology and find out if it's doing the same thing. Now, if we get the same shape from 1 month to another, well, you're not in homeostasis. Now, that makes you a candidate for the care. That increases your likelihood of becoming a candidate for this type of care. Then we make our physical exam, we perform our x-rays. And
You
put
mean
together
when
a
it
package.
reads the same every few months, you said? Every few weeks?
Weeks,
Weeks.
months.
And that makes me a candidate. If it doesn't, then
Then you are not a candidate. There's nothing wrong
then
with
I'm a
your neurology.
candidate for what?
Maybe the nut house?
Nut house?
No, it's we're simply looking for this pattern because this thermographic signature, this pattern, is just as individualistic, just as unique as your fingerprints, as your DNA. Everybody has their own unique pattern.
Okay.
So
okay.
what we're looking to do is once we found a pattern, we have established a pattern, thereby establishing the presence of the subluxation or the foot on the water hose, right? An interruption of the flow of information.
I've gotten that metaphor right now. Okay. Yeah.
So we've established that. Once we do our physical exam, we do our x-rays and actually calculate exactly where the atlas went, either left or right, up or down, rotationally. And that is all clear for any problems that may stop us from adjusting. Then we put that together in a package. We present it to you at your report of findings, and then we move forward. On that day, if you like everything.
How do you move forward? What is the procedure that you perform then afterwards?
Well, after the patient is ready, everything looks good, then we make the adjustment. Now, what is the adjustment?
Yeah.
That is performed to the atlas. It's done on a specialized table called a knee-chest table.
Knee chest?
Knee chest. Mm-hmm.
Like a massage table? No.
No, very small.
It's a different shape.
Yeah. It allows
I've
for
never
the patient.
seen that. I've never heard of it.
It's very rare.
Is it very commonplace? No, it is not.
No,
Extremely
not at all.
rare. Extremely rare. What you would do at this table is allow the patient to place their head on it in such a manner that would allow us access to the atlas.
Can you describe a case that you might have done? A patient that had any ailment, then you went through the process, and what did you do? How long did it take for him to heal or recover? Can you take any story and cite the example? Recently, Philippines, local.
Sure, I have a story.
Could you? Yeah.
Yeah, I have a 9-year-old patient.
Yeah.
Slightly autistic.
Okay.
And some of the things that I really wanted to do was do a before and after measurement of behavior and different, just different things so that we can compare before the adjustment and after. And before the adjustment, as with most autistic kids, there's problems with communication and things like that.
Yeah.
But after the adjustment, and this is not something that happens overnight or right after the adjustment, everybody reacts differently.
Mm-hmm.
But one particular patient that I did have, I noticed that he is more expressive. And it took a little bit of time, I'd say about a couple of weeks of seeing him after a few visits. He was more expressive. So if I'd talk to him and just say hi and things like that, I could see that he was actually, trying to communicate back to me.
He became clearer.
Yes.
Did he? Yeah.
Mm-hmm.
Okay.
And instead of just sort of reacting to what I do, I could sense that he was reacting to my questions because he would try to actually physically move his hand to meet me where I was.
So what you're saying in essence is that you did open up that window, the view of the brain to the rest of his performance. You were able to open it up or maybe give him some clarity.
Right, exactly.
Yeah.
It's the idea that whatever level that he is functioning at, the upper cervical adjustment aims to increase that so that if his brain is functioning at, just as an example, 85%, then our goal is to make sure it's functioning at least 90 to 100%.
Right. So even emotional conditions, people who are depressed or angry or low on attention, would that also be, would ACC adjustment also help there or no? Because I would assume that when people are in pain, mental pain or emotional pain, it's also a little bit of energy and nervous system. Am I right in assuming that?
It's all connected.
Yes.
Yeah? Or a person who's hyper, for example. Would that be a case too?
Sure.
Right.
Why not? It would have to undergo the same process. We have to do the thermography first because symptoms alone are not enough to have someone undergo a procedure. We must validate it through the neurology so that there is evidence of the subluxation. Because once the adjustment is made, we tend to only adjust once, sometimes twice if needed. But we don't want to make many adjustments. We want to make one adjustment.
Why is that?
Because once the subluxation is gone, the body then has the ability to hold the adjustment, which means that the pattern does not come back. That neural signature of sickness does not come back. And we have your scan history. We have your neural history so that we can see if you need an adjustment. Every time you go to the dentist, you don't want your teeth drilled. So it's the same thing here. Every time you see your
so
doc,
you don't
want
make
an
adjustment until recovery is done. You only make adjustments once or twice, and that's the most you can do?
That's the most that we need to do. It is not necessary to make multiple
Wouldn't
adjustments.
you need to do until recovery, 100% recovery? You know?
No. Why?
Yeah.
Because God has given us something called innate intelligence.
Oh, okay.
The
Right.
innate of the body. We can say that the adjustment frees the innate. It's stuck. It's stuck
Okay,
in the mud
okay.
out in the jungle. And it's about to get eaten. So
Right.
we break him free. We pull him from the quicksand. Now he can run off and save himself. That's what your body does. We remove the subluxation. The innate intelligence can then express itself to whatever is optimal for you, because we are all different. Then the body will start to heal. Now, if you go and fall down a flight of stairs, you
Yeah.
might need another adjustment. Or somebody hits you in the
Right,
head with
because
a
if there's a
baseball bat.
physical impact, if
There's
there's
a
another
trauma.
accident, then maybe, because the physical impact also affects your neurology and psychology.
Exactly.
Because
Okay.
the atlas acts as a fuse. When we encounter trauma, the fuse pops out to protect the overload of the circuit.
Doc, I kind of get it. I kind of get what you do. And it does make sense to me in a way, but I would probably need to go through a couple of examples to understand
Sure.
it. But let's take a little break, and then after the break, since we have only 15 minutes left, let's talk a little bit about how to manage bone health, or neurology in your case, no? A combination of those, and what are your recommendations? So is that okay? So have you achieved clarity on what you do on adjustment of the subluxation? Am I right? Yeah?
It's a mouthful.
Okay, good. So let's take a break, and we'll come back and talk to Dr. Malcolm Warren and Mia Balbas, and we are talking about bone. We are really not talking about bone health and wellness. We are talking way beyond that, aren't we? We are talking about overall wellness. Okay. All right, stay watching. This is Expert Insights, and we'll come right back. Good morning. Welcome back to Expert Insights. I'm your host, Raju Manthi, and we are talking to Dr. Malcolm Warren and Dr. Amia Balbas, and they have just finished explaining to me subluxation and the adjustment of the ACC and how that helps you recover from many ailments of the body and the neurology. Am I right? Mm-hmm. Give us now tips on staying healthy, holistically healthy, mind, body, and nervous system. What are your tips, Dr. Malcolm Warren?
You know, one of the greatest things you can do for yourself is to start using Himalayan pink salt.
Okay.
Himalayan salt, very, very important. Why? The minerals. Most of us today, I'd say about 98% of the people in the world are minerally deficient. And that is the basis for a lot of problems, health problems.
Yeah.
Minerals, minerals, minerals. So make sure that you're getting your minerals. Use the Himalayan salt because that will give you your minerals in a electrically alive form without getting too deep into it.
Why the Himalayan salt? I mean, does it carry calcium, iron, and every other mineral?
Is it 85?
Yeah.
85
It's
minerals.
about 85 minerals that we would need on a daily basis that's actually in the Himalayan salt.
Yeah.
So it's a lot more nutritionally packed compared to the average,
Salt.
iodized salt and table salt, that kind of thing.
Yeah.
So
But would you recommend taking supplements, mineral supplements?
Most definitely. I would like to touch on for a quick second. I know I get too deep into things.
No, go ahead.
but
Make my
stop
day.
me.
Make my day. Make my day. Make a day. Yeah.
So, okay, let's touch on these things really quick. We're going to use what's called the United States Pharmacopoeial Standards. This is basically what the U.S. has set up as the standards for various nutritional protocols. So, two big supplements that are on the market now are your chelates and your colloids. What is the difference?
Yeah, what are they?
A chelate is a tablet. Okay, a chelate is oftentimes absorbed roughly 20 to 40%, according to USP. Your colloid is absorbed about 98%, according to the same. Now, why? A colloid is water. It's a liquid. It means that the nutrients in the water column are electrically charged and they hang there. That is the way the body operates. That's the way the body likes to absorb things. You absorb more with a colloid. If you do...
Well, these are externally available supplements.
Yes.
Keloids and colloids.
A chelate and a colloid. You want colloids. Chelates, you're only talking about 20 to 40% absorption.
By the body or by
the body?
Okay.
By the body. And it's due to the fact of it being a chelate. It's just a lower form of absorption. Not to get too much into things. Tablets versus liquid. You want to take all your supplements as a liquid, especially calcium. Please never take calcium supplements, calcium tablets. Don't do that to yourself. There's a million studies out there. Increases your risk of heart disease by 40%. Because the calcium's a really big fat guy. He needs a lot of help to be taken into the body. So he needs people like vitamin D. He needs strontium. He needs a lot of other friends to help him bind. So don't take calcium by itself. You want calcium to be in.
So you're saying calcium doesn't get along well with the rest of the minerals in the body? In the tablet form?
Yes, yes. Exactly.
But in any other format, like food?
Totally different.
Through broccoli. Broccoli is calcium, am I right?
Lots of calcium.
So that is easily absorbable,
Right.
rather than taking bicalcium or something. Okay.
And also bone soup, another great,
Bone
fantastic
soup?
thing. Would you like to talk about bone soup and just a quick cleanse?
Sure, it's exactly what it sounds like. You take bones, so whether it's beef bones or chicken bones or pork bones, what you do is you just boil it in water for at least 4, 6, 8 hours, even up to 12 hours. And you just let the minerals come out of the bones into the water, into the broth.
Right.
And you can throw in whatever vegetables you like.
Right.
And then you just drink it. And the broth itself is packed with minerals and vitamins. And if you've got fat on the bones,
doesn't that take in minerals or proteins from the bone marrow, which is an internal organ, and that's not advisable? That's high on uric acid. No, it doesn't.
I wouldn't say, yeah.
No, you would recommend bone marrow as a good diet?
Sure, why not?
Yeah. Well, isn't that too extreme?
I mean, overkill on anything is bad, but the thing that you have to really worry about with your fats, because fat is a really big topic out there, fat and cholesterol. The danger, and you're going to hate me at home for this. You're going to hate me. You ready?
Okay, go ahead.
The danger. Fried foods. Fried foods are your danger. Whipped cream.
There goes KFC.
Fats. Yeah, anything that's oxidized, mayonnaise, because these have been burnt. These fats have been burnt. That's what it means to be oxidized. It goes into the body and it just destroys.
Stays there
as
synthetics.
It'll thicken the lining of plaques in your arteries and whatnot. So stay away from your fried foods. I tend to like to stay away from oils in general because oils rust just like apples. You take an apple, cut it, put it on the counter, browns. Oil, pop the cap on it.
And no matter what kind of oil it is, whether it's olive oil or canola oil or all kinds, doesn't really matter. Whoa, wow. Okay, how about other health practices like exercise, swimming? What are your recommendations to stay bone healthy and overall healthy, besides taking in minerals in their most natural form, right?
Yeah, that's the best. That's always the best.
Yeah.
I would suggest engaging in some sort of resistance exercise. So whether it's weight training via free weights or weight training versus via resistance bands, or even if you just walk with a couple of water bottles that you fill up. Anything that provides resistance to your bones, your joints, your muscles, all that really helps keep your bones strong. Anything else?
Contralateral, ipsilateral.
Sorry?
We're doing different sides.
You can't whisper on TV, remember that. Okay.
Looking at different-sided exercise. So one of the great ones you were showing me for tricep work. So I want you to demonstrate it. You do it the best.
You can.
I guess not in the dress. Okay. Well, when you're doing your workout, you want to concentrate more on just the cardio or building the muscle. You want to concentrate on nerve health.
How is that?
Now, you throw the nerves new tricks. So let's say that you are going
Go ahead. You may stand up here. But okay.
Took this guy off.
Take Jones with you.
Because I stay away from radio frequencies.
All right, not too tall. All right.
Okay, so you would take, let's say, your barbells, and you would, let's see, I'll come over here.
Okay. Yeah, there you're okay,
so you
right.
lift one leg, lean out straight, and then do your workout.
How does that help the nerves?
Because what you're doing is working on the what's called proprioceptors, motion
Just
detectors.
motion detectors.
Is that English too? Okay.
They
Sounds
look
like
at
a
where you are in
dinosaur.
Old
space.
English.
And they will help to stimulate the nervous system. They help to stimulate the cerebellum, that little small part back here. That helps for
I know,
motion.
I get it. So what you're saying is not just dead weight or exercise, but exercises that require you to balance and think at the same time.
Dynamic motion.
Exactly.
Yeah.
Yes, sir.
What was the name? What was the name? The Jurassic name? Proprioceptor.
Proprioceptors.
Proprioceptor. Okay, there you go. So that's yoga and Pilates
Actually,
because those are balance and strength.
yes.
Not because
Absolutely.
okay.
Yes. Go
Fine.
yoga. Love yoga. Love your yoga.
Right. How about, Doc, now other ailments of the muscle and the bone, like uric acid pains and rheumatoid arthritis or rheumatism? How about those? Well, how are they related to the whole system, the nervous system?
Now, those are still mineral deficiency diseases when we're getting into bones,
Yeah.
mineral, just nutrient in general. Well, that would take us another 30 to talk about.
We
but
have 5 left. We have 5 left. Yeah.
get your minerals. Just to make things easy, get your minerals. I would say if somebody's watching right now with one of those arthritides, first thing you do, you remove the fried foods from your diet.
Yeah.
Get off of bread. Please, please, please get off of bread.
You told me this
Gluten-free.
long time ago.
Yes, sir. No
Yeah.
wheat, barley, rye, or oats. Do that
Wheat,
for me.
barley, rye, and oats.
Yes, because those are
Yeah.
very inflammatory to the body. Step 2, do your bone soup. Make that bone broth.
You know, bone soup is nilaga or
Yes.
sinigang.
Or
No?
bululo.
Nilaga, actually.
Tinola.
Tinola, fine. So,
Yeah. And it's funny, many cultures have bone soup. They just call it different things, and they've been eating this for thousands of years.
wow, amazing, huh? Amazing.
Cabbage also. I really love cabbage. It's great for the stomach system. Eat your cabbage.
I
love
saw
your
somebody last Friday. I saw a friend of mine eat rice, cabbage, and bagong. I mean, she said that was a special diet. Rice and cabbage. I thought that's lots of gastric stuff. Is that right? There's a lot of carbo all there.
The white rice.
The white rice,
can be.
definitely.
Yeah.
And there's a whole other problem that comes with certain foods. Something that we could look at is our GMOs. You know, be
Yeah.
careful where you're purchasing your foods. Of course, everyone knows to stay organic. But
Yeah.
organic is a farming technique. GMO is a means of manipulating the genetics. So they're two different things. I can raise GMO organically. So make sure that you are shopping places where you have that option that you can purchase or things that are non-GMO.
You would recommend not purchasing GMO stuff.
Exactly. GMO free. I definitely
Okay.
recommend that.
All right. Doc, this does make a lot of sense to me. I now know how to keep myself healthy and strong. Age. Do you factor in age? Is that something that I can work against and keep my bones
Most
healthy?
definitely.
Yeah?
Most definitely.
And
Here's
the
an
same
anti-
process again. Himalayan salt, no fried food, bone soups, and
Curry.
curry?
Curry, cumin, cinnamon, curcuminoids. Because
And
they're-
exercise, you mentioned.
Yes.
Yeah.
Because they're all anti-aging. They actually stimulate a process in the body that's related to the aging switch.
Great, Doctor. It's been a wonderful interview. So I've gotten everything I need to hear from you. Is there something I should have asked you? Is there something you still want to tell me about minerals or food or your business, your profession? I get how to manage my bone health well now. Is there something else that you need to mention, something I might have forgotten to ask? So tell us, where should people find you? Where do people go looking for Dr. Malcolm Warren and Dr. Balbas? A clinic,
give,
an institute?
We give lectures at Health is In.
Health is in? Yeah?
That's the main place you can find us.
It's an institute or a place?
It's like a clinic.
Okay.
We give health lectures regularly there.
Yeah. And phone numbers, business, any clinic, or do you have a place where you go?
Oh, I'm sorry. I'm not thinking. Healthisin.com.
Oh, that's it. No, how about hospitals? Do you have a place where people can come in for therapy to you? Or
No, that's the place.
that's
That's
it.
where
That's
I
we
it.
just speak
patients.
there, yeah.
Healthisin.com. No more. All right.
That's it.
All right. So, and did you wanna? You said you're into business too, in mineral mining or something.
Oh, there's so much more.
All right. So if there's nothing, then thank you very much.
Thank you. Thank
Dr.
you.
Malcolm Warren, wonderful having you here. Mia Balbas.
Thanks so much.
Thank you. Good
Pleasure.
luck in your journey, and may you keep the bones of all Filipinos and the rest of the world happy. Yeah?
Thank you.
Thank
So
you.
that was Dr. Malcolm Warren and Mia Balbas talking to us about bone health and wellness. And I'm your host, Raju Mandian. I hope you enjoyed this show, and we'll see you again next Friday. Until then, have a great weekend and mabuhay. Healthisin.com.